we do have an expert today and he will be talking to us regarding hypertension. We're here at MACLEODS Medlive at Apicon 2019 and today we have with us Dr. K. Hari. He's a senior consultant physician at Dr. K. Hari's ASTER MEDICITY Satellite Clinic and he's also a visiting consultant at ASTER MEDICITY, Kochi. Welcome, doctor. It's so wonderful to have you here with us. So, doctor, according to you, what do you think is the initial therapy that is recommended in a patient who has been just diagnosed with hypertension?
That is a question actually asked by many of the patients also.
Okay.
As you all know that hypertension is a very dreadful disease. It's a silent killer.
Okay.
So that we have to see. Not one single reading is enough, but we have to take a couple of readings and see at a couple of different situations and see whether this particular patient has got hypertension.
Okay.
And now the World Health Forum, they say it is 130, 80 and above.
Okay.
Is called hypertension.
Okay.
So initially we have to brief them about the lifestyle modification
Sure.
and see salt restriction and all those things.
Yes.
And if they are obese, they should bring down their weight. The
Okay.
body mass index should come to normalcy.
Okay.
They should do regular exercise. So
Okay.
these are lifestyle changes we have to ask for this particular patient before we actually start on medication.
Okay.
But we should also see to it that we do a routine general examination in the form of looking at the lipid values, looking at the renal functions, and looking at the urine for any proteinuria, take a routine ECG, etc. So that whether any diabetes or hypertension related complication already developed in this patient. So in that case, the treatment modality will change. But once you have diagnosed that this patient has hypertension, and we can say it's a first degree, second degree or third degree or mild, moderate or severe hypertension. Depending on that, we will start antihypertensive therapy. Generally, we start on at present ARBs, which are like telmisartan, olmesartan, losartan, etc.
Okay.
That is the most commonly given first-line treatment.
Okay.
But they are also are given if they are associated with some other diseases like
Sure.
diabetes. We choose a particular ARBs so that is more beneficial to these patients.
Okay.
So we have to see, and then periodically we have to assess the hypertension of this value of these patients and see whether they are getting controls. We ask them to review after 2 weeks with the lifestyle modification.
Okay.
And if it is not under control, we again step up the dosage and
Okay.
see how it is happening. And they should follow the periodicity. When the doctor is asking them to come for review, they should come and just check that the BP is very much under control.
Okay. So I think regular and routine checkup is something
Along
that
with,
we
along
must
with
stick
lifestyle
to.
modification.
Sure.
Yes. Yeah.
So you did speak about the lifestyle changes. What do you recommend are the lifestyle changes that has to be incorporated in patients with uncontrolled hypertension above say 140/90, which is a very high level of hypertension?
Yeah, 140/90 is not a good value now because every year we have got a World Health Forum. They assess the hypertension and which should be safe for the patient so that the end organ damage is not happening.
Sure.
So end organ means like coronary artery disease, cerebrovascular disease, renal failure, etc.
Okay.
So the lifestyle modification is definitely one very big important thing. Like I told you in the earlier question that they should, if they are obese, they have to bring down their weight. They should do regular exercise, salt restriction, lipid
Okay.
lowering, and good sleep also is a must. Nowadays it is said that 6 to 7 hour good sleep is very essential for everyone, and especially for hypertensive patients. If they sleep less,
Okay.
and it can again shoot the blood pressure.
Sure.
But also lifestyle includes the taking alcohol and smoking. Smoking should be avoided.
Okay.
And alcohol, some say moderate amount, like once a week, once in social drinking is permissible. But my view is that even if you go for social drinking, you generally go into addiction, and it can really cause problems.
Becomes
Because if they
more
have
than
no
one time.
willpower to control
In a
where
week.
it has to be stopped, then
Yes.
there is no mean. So better avoid all these things, and of course avoid junk foods also.
Junk foods.
So see that the diet what is prescribed for this particular patient should be followed along with the exercise and the weight reduction.
So that is some valuable advice to go by.
So then I told you that particular antihypertensive drug can be added to start on this patient. And suppose on the routine periodical visit the BP is not under control, we can add one more drug, 2 drugs.
Okay.
So our main aim is that we have to bring the value to normalcy.
Sure.
And if 2 drugs are not getting enough, then maybe in long course we can BP is not controlled, we can go for the 3rd drug also.
Okay.
So all depends upon how the BP values are recorded. If above normal, then we have to see that BP should be under control. So we can add 1, 2 or 3 drugs depending on that.
Okay.
Even the 3 drug is not responding, then we have to think of there's a resistant hypertension or refractory hypertension. Then we have to reassess the patient why BP is not getting under control. So this is one point everybody has to think about.
Sure. So it all comes down to how the patient also reacts to the
Correct,
drug.
correct.
And speaking about anti-hypertension drugs, what is your opinion about Benedipin?
So Benedipin is in the market for last a couple of years,
Yes.
and this is a calcium channel blocker. And to be very frank, Benedipin has since started moving as other calcium channel blockers, because we are at present very comfortable with the earlier calcium channel blockers like amlodipine and cilnidipine, etc.
Okay.
And amlodipine is supposed to be the standard antihypertensive drug which has got a very good cardiovascular protection.
Okay.
So Benedipine is there, but we need lot of more review literature on this, about how safe it is going for the cardiovascular protection and renal vascular protection and cerebrovascular protection.
Okay.
So at present amlodipine is the mainstay in calcium channel blocker.
Okay, okay. Well, it was absolutely delightful having you here. We did have an insightful talk. Thank you so much, sir, for joining us.
Thank you very much.
sir.
Thank you. Welcome.